Hi, I'm getting back here to cover the situation of Yemen from the perspective of my UN NGO. And the first thing I want to start when we speak about this topic within the framework of the 73rd session of the United Nations General Assembly is the fact that this is the worst crisis in the world today. One child is dying every 10 minutes. 80% of the children in Yemen need help. There is 8 million Yemeni that are malnourished or suffering from malnutrition and starvation. If no bold action is done, this number could jump up easily to 10 million in the near future. And the situation in Al Hudaydah is the worst all across the country. Families are also afraid from riots, bombardments from both sides of the conflict. So no other country in the world has such a crisis or such a rate of the population suffering. And the United Nations agencies are working throughout the 333 districts of the country, which is the largest deployment of the United Nations aid worldwide. And according to the priorities of the UNOCHA from the humanitarian relief perspective, it's very important to focus first on reducing hunger and preventing malnutrition. Second, stopping another cholera outbreak. Third, protecting civilians at all costs. There is also, however, a need of a better medical coordination, a better access, a better cooperation in order to ensure that everyone receives the necessary help in the country. From the perspective of the work of the World the Health Organization, vaccinations were done versus cholera, polio, and diphtheria. The WHO trained coordinators, delivered water and health supplies, and provided also health services, including surgical intervention. The thing here is that there are three requests of the WHO in order to better the circumstance and the conditions in the country. First, there is a need of a guarantee safe access. Second, continuing the life-saving operation. And third, the workers must be paid for their interventions in Yemen, which is a very critical point. From the perspective of the UNHCR, there has been an action in providing shelter as well as cash and emergency relief items. However, since June, shelters were destroyed all across the country, and new ones are built right now, and the UNHCR is within that action. There is also coordination and collaboration between the UNHCR and the IOM and the government agencies in order to help Somali and Eritrean refugees to resettle, in example, in Sweden. According to the refugee agency, only political will can help this crisis to abate. From my perspective and the UN NGO work, I think this is the worst place for children to grow up at, and that the children are trapped in cholera, and this is a huge upset. Moreover, closing roads are obstacles to access to people, humanitarian need, and prevents also people from fleeing chaos along with their families. Ceasefire is a must in order to have hope in the Yemen situation. The reaction on the humanitarian crisis has been seen by several countries. Outside of the UN, member states have helped. The United States through USAID with the $1.2 billion that were provided by the United States since January 2017, in addition to other $1 million that are recently on different projects in Yemen. There's also the presence of the United Kingdom through UKAID and other actions therein. Denmark has put $20 million in the table in terms of humanitarian help. But many member states have urged a respect of international humanitarian law, protecting civilians as well. The permanent representative of Yemen have spoken about this topic in the context of the NGA 73 and the fact that the rebel and Houthis must be condemned by the international community before an international criminal body, and they should not be called de facto authorities. I do understand the position of the permanent representative of Yemen, But to me, it's very important for the United Nations to deal diplomatically with the situation in Yemen, especially managing cases like the harbor of Al Hodeida with the Houthi group 50-50. And that's the only way for the United Nations to get to its ultimate goal, which means saving civilians and preventing further chaos from escalating in the country. There is a need of negotiations. You cannot go on the force versus the Houthis. We all know that the majority of them are warlords that needs to be prosecuted internationally, as I said. But for the time being, in order to manage the situation the best, and this applies also to member states, it's very important to use a diplomatic solution in order to get to what I mentioned earlier, the ceasefire, and what the UNHCR is also striving for, which means a political will. So this is, like I said, I mean, something that needs to be seen ASAP. We spoke about it a lot during the General Assembly, and it's very important to come back to several points that could be called the Yemen Comprehensive Humanitarian Operations Plan. First of all, I want to speak about increasing the number of land, sea, and air entry points to 22 entry points. So the land having five land crosses extra, on sea having 10 ports that are active, and on air we have an opening of an airlift from Riyadh to Ma'rib. 24 flights will be stocked with relief supplies delivered to Ma'rib to be distributed among all the Yemeni governorates after that. It costs like $3 billion plan, and it will lower the cost of land transportation through road infrastructure upgrade projects. Second, upgrading roads, which consist on rehabilitation and maintenance of the arterial road that connects Sana'a, Dahl, Lahj, and Aden. Third, providing $1 billion to the UN Yemen Humanitarian Response Plan, donating $930 million to the UN Yemen Humanitarian Response Plan, which is the largest donation in history of the United Nations, supporting the Central Bank of Yemen in order to stabilize the Yemeni economy and preventing the Yemeni rial from a complete collapse, in addition to the previous $1 billion, in order to reach the sum of $3 billion, because the cost of this action, which is the fourth one, is $2 billion. The fifth point within the Yemen Comprehensive Humanitarian Operations Plan is related to increasing the total capacity in order to increase imports to Yemeni ports. The total cost of this is $40 million. The sixth point is the role of King Salman Humanitarian Aid and Relief Center, because this center has provided aid and relief in numerous tracks, such as food, health, and also all byproducts. And the beneficiaries in this context are around 6 million people. And seventh, finally, the Yemen imports report and improving it through land, sea, and air entry points. So I want to get back also to the help that has been made in the donation of the Yemen within the commitment on the Yemeni crisis that has been made by some member states. As I mentioned, that includes the Kingdom of Saudi Arabia, the United Arab Emirates, Kuwait, the United States, the United Kingdom, Germany, Japan, Canada, Sweden, the Netherlands, the Republic of Korea, Denmark, Norway, Switzerland, the Republic of Ireland, Belgium, Australia, Finland, France, Luxembourg, Russia, and finally an organization, the European Union. If I want to get back to speak about this, very important to focus on key factors: the people in need, the people reached, and the people targeted in every fraction. So, and also when we speak about fundings, about the billions of dollars requested, the billion of dollars received, and the rate of fund that has been achieved thus far in the segments of FSA, health, the WASH, nutrition, shelter, CCM, refugee and migrants, protection, EECR, education, logistics, emergency telecommunications, and other miscellaneous topics related to the safety of Yemeni people. So very important here to mention the rule of the operational presence, as I mentioned it earlier, and the fact that the humanitarian expansion of presence across has expanded all across the country, reaching millions of people every month. And in 2018, more than 194 organizations have provided services in 100% of the district, including food, nutrition, water, sanitation, and healthcare. As I mentioned earlier, the 333 districts of the country are targeted within this context of action. These include the health and wash response. Very important to mention here, the principal activities is vaccinating people, chlorinating water sources, pre-positioning supplies, and retraining health and wash teams. The cholera is a top priority because 82 districts are at high risks of cholera outbreak again. 16 million people without access to water and sanitation. 18% of the districts are without doctors, and more than 50% of the health facilities, less, sorry, than 50% of the health facilities are functioning right now in Yemen. So very important to come back to this issue when we speak about the cholera response and the service that have been delivered. 7 million consultations through supported health facilities. This is coming also from the sources of the WHO. 180,000 deliveries assisted by skilled birth attendants. 390,000 children under the age of 1 received the Pentatree vaccine. 17,000 cases of trauma were treated. 2 million people received hygiene items monthly, and we have also noticed 4.9 million people benefiting from support to public water networks. Food security and nutrition response. That's also a very important angle, and the principal activities we can notice here that we can work from perspective is providing a monthly emergency food assistance, treating acute malnutrition in children and pregnant and lactating women situation, and providing livelihood support. The key objectives, the first one is to improve, of course, the immediate household availability and access to food for the most vulnerable. We speak about food security and nutrition context of action. The second point is to improve household food security for at-risk group by supporting agricultural, livestock, and fishery systems and assets. Third is to reduce acute malnutrition through identification, referral, and treatment of acutely malnourished boys, girls, and PLWs as well. And finally, the fourth point is strengthening emergency preparedness and response capacity of partners, communities, and authorities. Several districts, 107 in Yemen, are at a high risk of famine. From the work on the field, it's a disaster. It's a really situation that has to be seen live to understand how precarious the issue is right now. 17.8 million people are food insecure, and 8.5 million people severely food insecure. So there is a scaling up strategy that must be done in terms of nutrition assistance by analyzing the people reached with food assistance and the nutrition response within the same diagram of people reached to see how the thing could be improved. Working under some of the most difficult conditions in the world, the humanitarian community in the situation of Yemen has made it important that it's very important to have scale up the food security and nutrition response, and that goes from the start of 2017 when partners have reached 3 million people with food assistance. By the end of the year, they were reaching 7 million, and recently in June 2018, they reached 7.4 million. This is to analyze the context of scaling up food and nutrition assistance and how it is going within the context of the food and security nutrition response. Very important also to mention within this context. I mean, it's a very huge topic, and trying to synthesize a lot of things that has been done is also the UNFPA humanitarian response in Yemen that has been improved in 2018 with an impact on women and girls, because there is the facts are 22.2 million are in need of some assistance, some sort of assistance. 13.3 million are in acute need. 16.4 lack access to basic health services. 12.9 are in need of protection. 30 million women internally displaced and returnees. That's the number. 3.25 million are women of reproductive age between the age of 15 and 49. 1.1 million are malnourished, pregnant, and lactating women that I mentioned earlier when we were speaking about the food malnutrition aspect. 75,000 are pregnant women at risk of developing complications. 50% of the health facilities fully functional across the country. But again, as I mentioned, this is from the UNFPA perspective. The UNOCHA says that there is less than 50% that are working right now, and from the window of the WHO reports as well. 3 million women and girls are at risk of gender based violence. 60,000 women are at risk from a different form of violence. And finally, 48% of the women are illiterate, which is also one of the cases that has to have intervention on. As I mentioned on that fraction earlier, the budget also includes education as well. Very important to hear the voice of women and girls. This is also part of gender parity, and we double dip when it is in a situation of crisis as precarious as the one in Yemen. The year 2017 have seen several achievements from the UNFPA in this context of action, and what I want to get back here is what they are trying to do in terms of reproductive health in the humanitarian response, in terms of strategic priorities. There is an availability of life-saving reproductive health medicines, suppliers, and equipment in health facilities that has been increased. There is mobile medical teams and clinics that are providing reproductive health services that includes also safe deliveries and are integrated with the nutrition services for pregnant women, as well as regarding the situation of disease prevention information that are targeting women and young girls. The strategic priorities of for UNFPA, cash-wise, $45 million to the total funding requirements. 3.45 is the million is the targeted population. Of course, the priority within a budget of 22.5 million is reproductive health, and 22 million remaining for the protection of women and girls. So this means that they have angles in strengthening the health systems to provide emergency obstetric and neonatal care and other integrated reproductive health services to reduce the maternal mortality and morbidity. The second point that includes these strategic priorities and this budget is about strengthening mechanisms to prevent and respond to different forms of violence, including the engagement of men and boys as agents of change, and that will help a lot with the issue of gender parity and the actions of the UN Women and the UNDP as well in the future in Yemen. And the third point for the UNFPA specifically address the reproductive health and protection need that results from the most recent escalations, including the famine, including the emerging health epidemics. All that has to be taken upon consideration as soon as possible. The 2018 funding requirements overview. If you want to do an analysis, right now $21 million among the 44.5 that is required has been funded. The funding gap here is $23.5 million. The funding requirement toward the humanitarian response basically is from a margin of error of the month of August 2018. The operations and the program support costs are included in the overall costs though. Program areas of this 2018 requirements are also related to emergency obstetric care, reproductive health kits, mobile teams and clinics, capacity building and awareness raising, service provision, capacity building and awareness raising when it comes to protection of women and girls. The first one was regarding reproductive health, and of course coordination. The direct beneficiaries, like I said, will be mostly female, but there is also a perspective for male population as well. Unfortunately, the geographical coverage of UNFPA is mostly on the west of the country. I mean, the intervention covers 21 out of the 22 governorates in the country, with a team of 41 staff members and 6 international and 35 national among the 41. The overall coordination happens at UNFPA's office in Sana'a and in other provinces through joint United Nations humanitarian hubs. UNFPA is currently present in all 5 operational UN humanitarian hubs: Adan, Al Hudaydah, Ib, Sa'da, and Sana'a, where close monitoring, of course, is done from NGO perspective, from civil society, vis-a-vis the evolving needs lead to the regular adapting of the humanitarian response. But very important to mention that situation like in Al Ghaida, which is very close to the border with Oman, and even a little bit western than that at Al Mukhala city. It's a very very terrible situation that has also to be taken care of. As I said, the big notice here is that all the things, the mobile clinic team, the emergency obstetric care of regarding health facilities, the dignity kits, the GBV services, as well as the midwife home-based clinics. The majority of them are in the west of the country, and that's very important to mention within the territorial management of this crisis. So we have to do something. What if we fail to respond? That is a very important thing. I have tried to bring the best synthesis when it comes to the work of my UN NGO regarding the situation in Yemen. It's as big as Syria today. It's level 5. The two countries are collapsing totally, and I want the international community also to hear this voice, to hear this situation from the perspective of my NGO. And I'm looking forward to having bold action in order to improve the situation of Yemen, one at a time, but for the best result possible ASAP. Thank you very much.